So let's explain the difference between total testosterone, free testosterone, and then I'd love you'd mentioned a few labs, but what is your kind of optimal, and understanding the context is important, but what's sort of the optimal lab numbers that you'd like to see for both of those?
So total is a no-brainer. And usually anymore, it used to be a lot of primary care docs would just order a total testosterone.
Mm-hmm.
The labs, like the big labs like Sonora and LabCorp and some of the others, they have changed it. So if you order a testosterone, you get a total, you get a free testosterone, and you get a sex hormone binding globulin. You know, those three things are usually done together.
Yeah.
When a woman that comes to me that just has a total testosterone, I mean, if it's so normal is going to be of a total is probably going to be around, I think it's around 9 to 52 or something like that. And most women, so if I know if a woman comes in and her total is 19, her free is probably going to be low as well because she doesn't have a whole lot of testosterone floating around. But you're not so concerned about the total testosterone because that total testosterone, a percentage of that is going to be bound up by this sex hormone binding globulin.
HCG, yeah. Mm-hmm.
So that will then, when it grabs onto the testosterone, it inactivates it. So that's why you want to know the free testosterone, because that's the percentage, or that's the actual hormone floating around in your body that can activate your receptors wherever it is on bone, on vaginal health, on hair, and all those things. So if you look at a total free testosterone, like I said, it's going to be 0 to 6.4 usually is the number. And I would say 95% of the time women will come in to my office under 1.0. It's usually much lower than that, like around 0.3, 0.1, but in general, 95% are under that 1.0. And that is almost across the board. I mean, I see women that are in their 20s and they have low testosterone. So it's pretty rampant.
And so let's talk about some of the options for treatment then. So there's, and there seems to be a lot of controversy in terms of TRT for women. We were mentioning in our exchange, you're like, there's like 10 medications for guys, but there's no FDA approved, path for women. So how do you navigate that? I mean, I have some strong thoughts on lifestyle interventions in terms of how to elevate T, but how would you approach that as a clinician in practice?
Well, you having strong thoughts is a shocker to me. I'm just mortified by that. But to really come at it, you want to talk about like the different therapies or what the steps you can do to raise your testosterone, both directly, maybe.
Yeah. Okay. I imagine I'm your patient. I'm coming in at like 0.3 and you're like, okay. And I have all the symptoms, low libido, hair loss, weight gain, all the things, chronic fatigue that's unrelenting. What would be some of the options that you might present to me?
I kind of look at all of these imbalances in 6 ways usually. So for let's talk about the nun, the archetype of the low testosterone woman. I always have this kind of what I would call a spiritual practice, or something that is just some sort of a practice in your life that you do. Now, what is it? And if I look at the storyline, what is it that nuns do that could make them, not feel great? Well, they cloister, they stay indoors, they don't go out. And so a spiritual practice that I have for women that do this is you need to go out. You need to go interact with people, whether it's at the mall, just get out and move a little bit and just interact with whether it's family or whatever, but don't stay in the house. You got to break that pattern. Hormones would be another option, obviously. You can give a woman direct hormone replacement. You said there is no FDA approved form of testosterone that you can give to a woman, so you have it compounded. It's bioidentical and it can be made. What's interesting, how we have Viagra, which is a blue pill. About 6 years ago, they came out with a pink pill that was called Adi, and I think it's still available. Interesting. This is fascinating. It's supposed to be the pink pill, so it was supposed to make women have a better sex drive, right? Mm-hmm. And the study that was done on Adi, the pilot, had no women in it. So how they even figured that out, I don't know. But it also had nothing to do with sex drive. It was an antidepressant. It was similar to Prozac. So basically what we're conveying to women is it's all in your head, right? It's fascinating to me. So that's a side note. But I think hormone replacement obviously would be a big gun to bring in. I look at things like sometimes I'll go off. I was talking earlier about how I have a 20 to 25% woo factor. I like to talk about acupuncture. I'll sometimes refer patients if they're into essential oils, things like Vitex or some of the more stimulating ylang ylang or citrus blends. I often defer to Maritza Snyder's book for that because she's the expert. I look at things like exercise, obviously high intensity interval training, muscle building, weightlifting with big joint movements like squats, where you're going to get more bang for your buck. Because the more muscle you can build, obviously your testosterone will increase.
Yes.
Nutrition, I tend to go higher protein, higher good fat with people and trying to lower carbs, which is kind of more your area, but that's what I usually recommend. And then last would be supplements. And supplements are kind of like, one of those things you can add in. I think if you're on a good multivitamin, some zinc, some boron, you have a good like fish oil if you're not getting enough healthy fats, omega-3s. And then maybe even some of the weird stuff if you want to try like horny goat weed because it just sounds cool, but or tribulus or
Hopefully the name will confer the benefit of the
could be placebo for all I know, but
yeah.
it just but yeah, so I kind of come at it from all those aspects.